The Bay Area stay-at-home orders, they continue, and some people are not happy. Businesses and health experts alike are demanding to see the data that justifies it. But as KPIX5's John Ramos reports, so far, state officials are keeping it to themselves.
The state is forcing the shutdown of all outdoor dining in the Bay Area, but they're not in Sacramento. And so far, officials are refusing to say why. Last week, the state surprised everyone by allowing restaurants and businesses in the Sacramento region to reopen. They said it was okay because data models projected that the region's ICU capacity would reach the state's threshold of 15% in the next 4 weeks, although it hasn't yet. But then yesterday, the Bay Area's ICU capacity suddenly and without explanation jumped from 6.5% to 23.4%. Cynthia Ariosta with Trevina Pizzeria in St. Helena has a question.
How come that model didn't predict the Bay Area all of a sudden being at 23% this weekend? So again, it's just arbitrary.
She's part of an alliance of nearly 100 North Bay restaurants and wineries that have filed a lawsuit to lift the outdoor dining ban. Many spent tens of thousands of dollars to create an outdoor space, and they're now demanding to see the data that proves they should be closed.
Without anybody else being able to look at this data, whether it's, local officials or doctors or even us business people, to be able to predict a reopening, where is it? Where is this data? How is it being used?
So far, the state has refused to release it, reportedly telling the Associated Press that the data is complicated and might be misleading to the public if they should see it.
I'm not exactly sure why they're saying what they're saying.
Dr. Lee Riley is a professor of infectious disease at UC Berkeley School of Public Health. He says with open data, medical experts can do a better job informing the public. And without it?
If we don't have more transparency, I think it's going to contribute to this kind of distrust of information coming from the government.
And he says he has his own doubts about whether outdoor dining per se is really that dangerous.
We need more data. What's the evidence that these outdoor dinings contribute to transmission? We have those types of data from indoor dining, but I'm not familiar with any real data suggesting that outdoor dining contributes to most of the transmissions.
That's the case being made in the lawsuit. The restaurants are saying prove that outdoor dining is unsafe or let them reopen, just like in Sacramento. In St. Helena, John Ramos, KPIX5.